Hello, and welcome back to another episode of Straight Up With Steph. Today, we are talking all about TMJ and TMD. Back when I was a full time hygienist, this was one of the most challenging conversations that I would have for patients and challenging times for me to try to treat patients that had bad TMD because like it hurt for them to open their mouth, but yet that's exactly what I need them to do is open their mouth. And I felt like I didn't have the tools in my toolbox to really have productive conversations with them or even give them super useful advice because I didn't know back then. But now we know a lot more about TMD as far as its relation to forward head posture, which we'll talk about today. Obviously, malocclusion, breathing issues, sleep apnea. And throughout my career, most offices I was working at, with the exception of a couple, would just throw a night guard onto the patient and call it good. And maybe sometimes it would help, but sometimes it wasn't. And then I didn't really have anything productive to tell them as far as why their night guard wasn't working for them. Come to find out, there is a huge difference between just a night guard that protects the teeth and an orthotic, which we talk about today, which protects the teeth, but also kind of shuts down the muscle activity, which is causing all of the clenching and all of the pain that people can have because of TMD. I found the perfect guest today. She is a former general dentist, but now she has a TMJ, TMD only practice, which is pretty rare. I actually had the chance to interview her a few years ago when I was a guest co host on A Tale of Two Hygienists. And so I've known about her for a while. I've watched her YouTube videos, I follow her on Instagram. She puts out a lot of content for both patients and dental clinicians who want to learn more about TMD. And she tells us today that most of us are getting it wrong when it comes to TMD, and there's a lot to learn. We talked today about how it's diagnosed, what are some of the signs and symptoms, some really helpful self care tips that patients can use when they're prepping for a dental appointment or just to manage their pain at home, and some other new technology that's helping reduce or eliminate the symptoms of TMD, and some new devices that people can use at home to help with those symptoms too. And something that's gotten pretty popular is botox for TMD. So she gives us her opinion on that as well. She was a pleasure to talk to. She's just a wealth of information. So if you want to learn more about TMJ or TMD, whether you're a dental clinician or a patient, please check out this episode. I hope you enjoy it. Hey, it's Steph, and welcome to the Straight Up With Steph podcast, where we have real discussions around health and life and just trying to be better at both. Hello, Dr. Priya. Thank you so much for joining today.
Yes, thank you for having me. I'm excited to be here.
Me too. I have been following you for a while. I've watched your YouTube videos. I watch your stuff on Instagram. It's so awesome. I just
Thank you.
bet you're helping so many people with
Thank
like
you.
TMD, and that's a huge problem. So I appreciate what you're doing.
Huge problem. Yeah, thank you.
Yeah, you're welcome. So I guess just to start off with, you are a dentist, but now you have a TMJ, TMD only practice, correct?
Yeah, so I am a dentist and I practiced general dentistry for 11 years. And then I met my mentor in 2018 and bought his TMJ, TMD only practice in 2021. So ever since 2020, well, really 2018, I've been focusing my practice on TMJ, TMD. So no general dentistry and it's full TMJ, TMD, which is kind of rare. Like you hear of sleep and TMD, heavy sleep and a little TMD, but you don't really usually hear about like TMD only. There are some, but there's not that many practices.
Well, it's just like me, I've been a dental hygienist for, God, over 17 years now. And it's
Mhm.
like every day there's patients that have issues with their TMJ. And I feel like there's only so much we can do at a general practice. We just don't have the training and the tools that you do. So I guess first off, for people who don't know, because I have both dental and non dental listeners, what is TMD and how is something like that diagnosed?
Yeah, so TMJ, TMD is like the official name for temporomandibular joint disorder. Some people call it TMD, temporomandibular disorder. Some people call it TMJD. But basically, I kind of break it down as into like there can be problems inside your joint or outside your joint or a combination of those. So problems inside the joint manifest as clicking, popping, crackling noises, episodes of the jaw locking or catching or getting stuck. And so that sort of is how the problems inside the joint manifest. Problems outside the joint have to do with muscles and nerves and can influence inside the joint and vice versa. So muscles and nerves, TMD recognizes that there's a group of muscles and nerves that work together to guide and support the jaw. So if or when those muscles become dysfunctional, they sort of get trapped in a chronic pain and spasm cycle. And it can be very painful. It can range from mildly uncomfortable to super painful. And the number one way it typically manifests is headaches or head pain. And that includes migraines, ice pick headaches, occipital headaches, tension headaches, etc., closely followed by ear-related concerns. So like ear pain, stuffy ears, dizziness, hearing loss, hyperacusis, so the opposite of hearing loss. Lots of different ways the ear symptoms can manifest. And then, of course, jaw pain, neck pain, shoulder pain, tooth pain, gum pain, numbness or tingling in the face or fingertips. So TMD is kind of interesting because it can manifest in so many different ways. And most people come to me with some combination of those symptoms. So I think a common misconception is you have to have clicking or popping noises in your joints. You have to have episodes of your jaw locking. You don't. You can have totally healthy joints, no clicking, no popping, no crackling, but you can have a ton of pain, and that can be coming from the muscles. And so that's a brief synopsis.
So I would imagine you get patients referred to you or come see you because of like if they have headaches or they do have jaw pain. And do you have like a checklist that you kind of go through and they're like, oh my God, I have all of those things?
Their new patient intake paperwork is pretty extensive. And so many people will be coming to me because their jaw locked closed or something very specific. And then when they start filling out the paperwork, they're like, oh yeah, I've had headaches for years. Or yeah, my jaw does kind of hurt or feel tense most days. Or I do have a lot of neck pain, but I didn't think that was connected to my jaw. Like, so the intake paperwork is so detailed. And I think that's what really makes people, before they even meet me, helps them to understand, maybe all this is connected.
Yeah. And you mentioned before, like this can really interfere with someone's life. And I know me, like I'm a clencher and grinder. I do have a night guard, which I want to talk to you about in a little bit because I know I still clench on it. But how does something like this, when it's untreated, how does this affect someone's life?
I mean, it can range so much. So it can be like, you might have clicking and popping and some headaches every now and it never progresses beyond that. So how much is that affecting someone's quality of life? Probably not that much. Like if their jaw doesn't lock or if the pain doesn't become debilitating. But it can progress and it can become debilitating, and the jaw can start to lock where you can barely open. The muscles become more inflamed. It turns into constant head pain, constant jaw pain, constant facial pain. And so it can range so much. And the people that come to see me are usually at the more debilitated end. Otherwise, they don't seek treatment.
Is this something that I would imagine, like anything else, it's better to treat it sooner rather than later before it becomes super advanced? Like, does it get more difficult to treat the longer someone lets it go on?
It can. It certainly can. And it's so hard to say what the future holds, right? Like some people will have a clicking noise in their joint and it never progresses to the jaw locking. It never progresses to any significant pain. And they can live their whole lives like that, right? And then other people, it progresses and it progresses fast. And there's so many factors that contribute to that. So like an imbalanced bite can contribute big time. Sleep apnea will make it so you clench and grind your teeth more, which makes those symptoms worse because you're overusing your joints and your muscles. Any whiplash incidents, any car accidents can really have a significant impact on the neck, which can make all the symptoms progress. A long dental appointment, getting your wisdom teeth out, or a really long dental appointment when there's an underlying issue that's been really mild and hasn't gone noticed or it's not been treated, can suddenly make that progress. So it really depends. Like everybody's so different. And of course, I see the people at the worst end of the spectrum, right? They're the most debilitated. So that's what I see. But I'm sure there's people out there that I don't see that, where the pain isn't that bad or they can just live with it.
So with a patient, I know I've had this issue as a hygienist, is that a patient comes in and they're like, I have TMJ, which always, it kind of cracks me up when people say I have TMJ. I'm
Mhm.
like, yeah, me too. But
We all
I know
have
what they're
one.
saying.
Yeah.
Yeah. But it's like, I need to get in there and I need them to open. In some areas, I need them to open pretty far, but also I know that it's going to hurt them. So are
Mhm.
there things that we can do to make that easier for them during the appointment?
Yeah. There's a video on my YouTube channel. It's like some ridiculous name. I should have called it something else. It's like upcoming dental appointment with TMD question mark how I can help you or something. It's some stupid name. Yeah, I could probably send you the link and you could link it to the description for your podcast
Oh,
if you
yeah,
like.
that'd be great.
But yeah, so it's really geared towards the patient. So I ask my patients to do this when they go into their general dentist office for cleanings. I say, well, first off, if their jaw is locked closed and they can barely open, they cannot have a dental cleaning until they're unlocked. That's what I say. And I've talked to dentists about it, and they're like, well, I need to get in there and do a cleaning. I'm like, they can't open their mouths. You need to get
Like,
in there,
how's
but
that
you
even
physically
possible?
can't. Yeah. And so if they're not locked, I have them watch this video, and basically it tells them to sort of call the office in advance and say, hey, I'm going to need breaks during my cleaning every 5 minutes. And that's frequent, but their jaws can't handle more than that. And in those breaks, I coach the patient themselves on how to like massage their jaw muscles. And I have them, if they're in treatment with me, which they usually are if they're my patients, I have them wear their orthotic to and from the appointment. I had them put like a sticker on their face to remind the hygienist or the dentist to give them breaks. Like there's
Okay.
just little tips and tricks that in that whole video to make the cleanings more tolerable and to prevent a flare of their symptoms after the cleaning.
Yeah, and that was something I always was like, "Oh my god, am I gonna trigger something? Are they gonna be miserable after this just because I need"
Some
it's like,
people
I need to
are, but
clean their
it's
teeth,
not your
but I don't
fault.
wanna make it worse.
Right. You're doing what you need to do. But some people are on that 8 out of 10, 9 out of 10 pain level. And then they have to hold their mouths open, and it's hard. It's hard to tolerate.
Do those bite blocks, do those help or hurt? Because that's something I would use too.
Yeah, I feel like the big ones and the medium-sized ones just hurt. I would,
Mm,
if you're gonna use one, like if a patient just can't stay open and they want one, I would try to use the pedo-sized ones. But I know
okay.
you have to get where you have to get to, but if you're gonna use the bigger sized ones, the breaks are like an absolute, they have to have breaks. So if that means that they have a longer appointment and they pay more for it, that's a thing that they have to work out between the owner of the practice. And that has to be worked out between the owner and the patient.
Yeah, okay. Any other that I really like that massage tip that you already talked about. Do you have any other self-care tips for patients at home that can help with flare-ups or just
Yeah.
overall TMD?
Yeah. There's a lot of self massages on my YouTube channel and my Instagram and
Okay.
everything. I am a huge fan of those microwavable neck wraps or neck pillows. Yeah, I
With the
love those.
beads?
They feel so good because the neck and the jaw go together like this. And so if we can get that neck calmed down, it'll usually help the jaw to calm down too. There's the TMJ massage pen that was created like in the last year and a half or 2 years by a really great young inventor. He's an engineer that suffered from TMJ problems himself. And so this TMJ pen so he quit his day job and like literally made this out of his apartment. I mean, it's ingenious. And it
Wow.
has vibration and heat. And so using something on the face and the temples, you have to be really careful. You can't get a Theragun and just go to town. You'll knock your head off, right? It
Yeah,
has to
those
be
and those
gentle.
are pretty aggressive.
They're very aggressive. And many people have asked me if they should use a Theragun on their jaw or their neck, and I always say no
God,
because you
I
could
can't
really hurt
imagine.
yourself.
Yeah.
Yeah, it's too aggressive. It's great for the rest of the body, but there's a TheraFace Pro that has a little bit of percussion that's okay for the masseters, but it's a little bit too much for the temporalis muscles. So there's a few tools in the toolbox that you can have at home, but if it's like a pretty moderate to severe condition, that's only going to hold you over for so long.
With the TMJ pen, you said it's heat and vibration. So is that basically to like stimulate blood flow in there to
And
help?
it feels good. It's like a nice little massage. It stimulates blood flow. Heat always, almost always feels really good for most patients. So yeah, I mean, it brings relief and temporary relief. And it's angled, the head of it is angled in such a way that you can really get into any like tight knots or trigger points in the masseter. And I think you can gently use it on the back of your neck. It's small and the vibration is low enough that you can use it very gently on your temporalis muscle, and that's a thin one, right? So you can't just put anything on there. You got to be really careful. Percussion is just too much. So that's why I like the TMJ pen because it has the vibration.
Okay. Since we're kind of along the same lines, like what are your thoughts on Botox for
Yeah.
symptoms?
So that is not like a first line of treatment. And there's only a handful of patients I do it for a year. So
Okay.
I'm not a huge fan of Botox for TMD, but I will say, I've seen patients that are in 9 out of 10 pain without Botox and it brings their pain down to a 4. If you
Mm,
need something to break the pain cycle and get through life without being super depressed, and I've even heard people want to end it from the pain of this, if
oh my
Botox is
gosh.
what makes you not want to end it, do it if it breaks the pain cycle for even a little while. So I'm not like anti Botox, but I don't think it's a great long term solution. I think all it does is paralyze the muscle. And if you paralyze the masseter and you keep injecting it every 3 or 4 months, every 3 or 4 months, every 3 or 4 months, you're going to atrophy it so much that if you already have sleep apnea or its little sister, upper airway resistance syndrome, the atrophying these muscles so much is going to make your jaw and tongue drop further back into your airway every time you sleep. So it can
Mm,
have really bad negative side effects long term, right? So I'm okay with, and I'll even do it for someone every 4 months if they insist on it, as long as they don't have sleep apnea or any hint of sleep disorder breathing. But it's very rare that I do that. I mean, that's like one patient a year.
okay. And with sleep apnea too, like it just seems like there's so many, it's like a puzzle that you're trying to put together when it comes to these patients. But could you explain the relationship between sleep apnea and
Mhm.
TMJ or
Mhm.
grinding and clenching?
Yeah, definitely. So with sleep apnea, if your body is struggling for oxygen, you can't breathe well. Your body goes into like fight or flight mode, which is a very stressful mode. We're not supposed to like live in that mode, right? The sympathetic nervous system kicks in and it's like something's wrong, something's wrong, something's wrong. So many of us, when we're stressed or when we're in that mode, we tend to clench or grind our teeth with more force, more frequency for longer durations. I think we just sink our teeth into whatever's bothering us. We can't go
Hmm.
around biting people, so we just clench, right? Um, Grinding the jaw forward actually opens the airway. So that's our brain's intuitive way of saying, hey, if I grind the jaw forward, I can get a better oxygen saturation. So grinding the jaw forward opens the airway, but that clenching and grinding night after night after night after night, it wreaks havoc on the muscles of the head, neck, and jaw and the jaw joints. And so eventually something gives. The jaw locks, or the pain starts, or the headaches start, or something gives to where you end up at my office. But the TMD can be the tip of an iceberg. It could be sleep apnea, as an underlying problem.
So I've been in offices where, and this was before we knew what we know now as far as sleep apnea and all that, but
Mhm.
we would have a patient that like clearly had sleep apnea. I mean, you can just tell with some patients that they
Mhm.
have it. And then they would be given a night guard, just like, here you go. And I'm like, isn't that going to make issues worse? Like, do we maybe not want to cram even more things into their mouth? Like, do you
Yeah,
see that a
yeah.
lot?
Well, first off, you need to get a sleep study. So, like
Right.
a night guard because you suspect sleep apnea is a terrible idea. So, whoever that
Well,
dentist
a
is.
night guard it's they got the night guard because they were grinding,
Oh, oh,
clearly,
oh.
like, just wear on all their teeth, but also, I'm like, "This patient has sleep apnea, like, is a night guard really the best choice for them?"
Well, I understand the wanting to protect the teeth because they're going to break,
Mhm.
right? But I don't think a night guard is the best choice. I think an orthotic is a better choice. It's still something in your mouth, but most orthotics help to guide the jaw down and forward when you wear it.
Is that what you've done, like, probably a million videos on the difference between a night guard and an orthotic, so
Well,
can you
thank you for
explain?
recognizing that because everyone just asked me that, and I'm like, I've done a million videos on it. Like, so thank you for acknowledging that.
Yeah,
But I
and
can
I'll link
explain the
some of
difference.
those.
I'm happy to do that.
Yeah, maybe just real quick, but I will link a video, at least one video down in the show
Mhm.
notes for people.
Totally. Yeah, it's hard. It's a very difficult concept actually to understand. And when I first started working with my mentor, it took me a while to grasp it. So totally, I'm happy to explain it. So a night guard protects your teeth from the forces of clenching and grinding. That is all it does. And it's important because you don't want your teeth to break, right? So I'm not saying
Mhm.
night guards don't have any value. But if you have TMJ problems, a night guard is not appropriate because it does not treat the muscles and the joints. That's what a properly, correctly made TMJ orthotic does. So I want to pause here in my explanation for a second and focus on the correctly made TMJ orthotic. There are dentists out there that make a piece of plastic and call it an orthotic. And then people don't have a good experiences. So they're like, I already tried a TMJ orthotic. Well, you tried a crappy one. And that sucks for them. It's really horrible for the patients. Like this whole field is so horrible for patients because they have to do so much of their own research. They have to try to find practitioners that know what they're doing, that understand how to diagnose and treat this. And so I will say that orthotic has to be correctly made for it to help. So back to the explanation. So a TMJ orthotic, the way I make it is we have software, we have technology, we have ways of measuring where the muscles are sitting at their correct resting length. This is neutral, this is relaxed. So most of us are sitting with either we're clenching actively, or even if we're not, we're holding the jaw in a way where the muscles are contracted. So many people will tell me that. They're like, I hold my jaw with so much tension, even if my teeth aren't touching all day. So
Yeah,
we
can it
find.
be open? Can they hold
Mhm,
it, like, be straining to hold it open? I think I do that when I'm hiking because
mhm,
my face always hurts when I'm
mhm,
hiking, but I'm
mhm,
not clenching, and it's always just
mhm.
confused me.
Yes. Yeah, you should get an
Huh,
orthotic
okay.
with me.
I'm
But
yeah.
so we measure where the muscles are sitting in their neutral state. Every muscle in our body has a correct resting length, a neutral position. The bicep is easy to visualize. It's neutral like this. It's contracted like this, right? I don't have big biceps, but you get the point. So if we can find that neutral, happy place for these muscles of the head, neck, and jaw and record that position, also where the joints are decompressed, and build an orthotic, an appliance that guides the jaw to that happy position. If we hold the muscles at their correct resting length and we decompress the joints for a significant amount of time, that takes the pressure off everything and the muscles have a chance to snap out of their dysfunctional state. And when they snap out of their dysfunctional state, the pain goes down. When you decompress the joints, when everything's been compressed up against each other, all the components of the joint, things start to feel better. So a correctly made orthotic will do that. A nightguard will not. A nightguard just protects the teeth. So they can look very similar, and that's the tricky part. Just like all eyeglasses look similar, right? They have frames. They sit on our ears, on the nose, right? But it's the prescription built into them that makes the difference for each wearer. And so many people will say, well, I want to know what it looks like. And I'm like, I'll show you, but you're going to think it looks like a nightguard till I point out there's very specific bite indexes in it. So my orthotics, most of them fit on the lower, and they have bite indexes built into them. So indentations built into them that guide the upper cusps. So they would be custom to your upper cusps, guiding them where to rest, putting the jaw in a really specific position or guiding the jaw to a really specific position. So just like if you wore my prescription eyeglasses, you wouldn't see properly, right?
That's such a good analogy.
Well, this is my mentor's analogy. I wish I'd come up with that. I wish I could say
Well,
that.
it's a good one.
But the one I came up with is just like an orthotic in your shoe will help with hip alignment. A good orthotic or worn on your teeth helps with jaw alignment. So those are
And as
two
far as the
analogies.
pain reduction, is it not only when they're wearing the orthotic, but it's like after too? Do they
Yeah.
notice a
So
reduction in pain?
what I do is I have to have those muscles happy all day. So I have people wear it 22 hours a day, 7 days a week when they start treatment. They only take it out to eat. Many TMJ dentists will say you have to wear it to eat too. So there's different views there. Now, it depends on where you want to go with this. If you wear something 24/7 that is literally guiding your jaw to a different position, you're even chewing with it in. When you take it out, your teeth are not going to meet. Now we're left with a new problem. So then you have to sign up for phase 2 treatment, which is either orthodontia to get your teeth to that position where the orthotic held you, or full mouth reconstruction, crowns on every single tooth.
Yeah.
So now we're talking about $50, $60, $70,000. Many people don't want to do that. So my mentor came up with a way of you take it out when you eat to drastically lower the chance of your bite changing. And then, but it still gets the muscles out of their dysfunctional state. So at the beginning, my patients were at 22 hours a day, 7 days a week. And then as they feel better, I wean them off of wearing it during the day and they continue to wear it at night indefinitely. So they can only wean off of the daytime wear once the symptoms are like gone.
Okay.
So that can take 4 or 5 months. That can take 3 or 4 months. It can take 6 or 7 months. So you have to commit to wearing it.
Can you talk with it in, or is it kind of
Yeah.
weird?
If it's only on the bottom, so it's not a top one, you're going to sound a little slurpy when you get it because there's something in your mouth. But your
Yeah.
tongue, surprisingly, it relearns where to go, usually within 2 weeks. So yeah, you can talk with it. But I mean, and at first people are kind of like, I don't want to wear this. And then when they start to feel better, they're like, never mind, I'll just wear it.
I bet they love it.
They love it. I mean, and for nighttime, I call it the adult pacifier. People
Yeah.
love their nighttime orthotic.
Well, that's how I am with my night guard now. I can't sleep without it, but I
Mhm.
also know it's not preventing me from clenching because I wake up and I'm just like, bearing down on it, but I guess at least it's protecting my teeth.
It's protecting your teeth. Are you waking up with pain?
Not pain,
Good.
no, just tension. So, I've got a list of like things that I know I probably should do, and that's on it.
That's on it. Well, and nothing will stop you from clenching. Even my
Okay.
orthotic, you're going to just clench on it, but at least you're clenching from a position where the muscles go from resting to clenching. You're not just clenching from clenching. And
Gotcha.
that's what makes the pain go down too. The only thing I found that stops people from clenching is disclusion time reduction therapy. That's the
Yes,
only
I
treatment I found.
okay, I'm really glad you brought that up because I saw one video on that, but I had never heard of it. So what
I
is that?
know. I hadn't heard of it a year and a half ago either, girl. I'm learning too.
So, yeah, just tell us what that is.
So, disclusion time reduction therapy uses a very, very specific sensor that's only 100 microns thin. So it is very, very thin. So it's 100 microns thin. You place it in between the teeth and you have your patient bite down hard, hold, and open. Bite down hard, hold, and open. Then bite down hard, hold, and with your teeth gliding against each other, you slide your jaw all the way right and then all the way left. So I'm going to demonstrate. Is yours video? Obviously it is. If we're
It
gonna,
is, yeah.
so I'm going to demonstrate. Bite down hard, hold. And what I'm looking for is canine guidance. We want those slides to be guided by the front teeth. But what we often find is there's back teeth gnashing against each other in those glides. And those back teeth gnashing against each other, the premolars and the molars, those back teeth have peripheral nerves that synapse directly in the central nervous system. No other peripheral nerve in our body synapses directly in the central nervous system. They all have stop off points before they get there. So the back teeth, the way our teeth come together, can influence our central nervous system, our muscles, our nerves, and it can keep us in fight or flight. Crazy, right?
Wow.
So
Yeah.
not only are we measuring the relative bite force, but we're measuring muscle activity at the same time, in real time with all those movements. And so based off of what the technology is telling us, we make micro adjustments on the teeth. We're removing microns of enamel. It's almost nothing. So there's 1,000 microns in a little itty bitty millimeter. And we're shaving a micron here, a micron there, a micron here. It's kind of like filing your nails. It's a light dusting. It is not going crazy. The patients don't have to be numb. It doesn't hurt. But it balances the relative bite force and it makes it so that the back teeth aren't gnashing against each other in these side to side movements. So it's eliminating those back teeth, those posterior interferences, thereby calming down muscle activity and calming down the central nervous system. That's profound.
Yeah,
So,
what kind of results have you seen with that?
it's amazing. I mean, like 85-90% success rate, which is the same as with my orthotics. But there are some people that don't do well with the orthotics. There are some people who taking it out and chewing with their teeth is enough to keep the muscles in spasm.
You have to
So,
eat.
yeah. So do I have them wear it 24/7 and make them commit to phase 2 treatment? Or do I take them off the orthotic and try DTR? That's what I
I would
do.
guess that.
Yeah. And there's a patient who wrote a really great review. Her name is Jen. We had been chasing her pain for over a year, and I could not get it to stop hurting when she chewed. I mean, hurting so much that she was popping like 3 Aleve a day.
Oh, man.
And this is soft food. I'm not talking steak. I'm not talking granola bars. I'm not talking granola, crunchy stuff. She was in so much pain and she never complained. I would be like, oh my gosh, I'm a year and a half into treatment. And like, what, you're the TMJ doc. Why aren't you helping me? Right. She never complained. And then I became DTR certified and she's a candidate. Not everyone's a candidate for DTR.
Okay.
Your teeth have to come together a certain way. You can't have wisdom teeth that are erupted into your mouth that you're chewing with. There's certain qualifications that you have to meet. And she was a candidate. And I said, Jen, why don't we try this? I said, why don't we take you off the orthotics for 5 days, 5 nights, let your bite settle? Because the orthotics will give you the sense of like a false bite. When you take them out, your teeth feel kind of weird. And then the muscle memory takes some time to come back to get your bite back. So I said, let's let your bite settle to where it's always been. And then let's do DTR. After the first DTR appointment, one appointment, all her pain with chewing went away. And she was able to sing again. She couldn't sing for 10 years. It just hurt too much. She sang for over an hour. She's a singer. So I was like, what? And I mean, it's a hobby. That wasn't her career singing. It was a hobby with like church and stuff, but still important to her. Her jaw pain still was there a little bit and her headaches remained. So after her second appointment, all that went away. And I was like, oh my gosh, we were chasing our own tails with the orthotics and not getting anywhere. Until finally I did DTR on her. And there have been a few patients where we had to do that. So just another tool in the toolbox. It's really an amazing technology. And it's been around for like 35 years. So
I worked for a doc and I feel like he did that, or at least a version of that, but he called it equilibration. Is that kind
no,
of the same?
no, it is not the
Oh,
same thing.
oh, okay.
Occlusal equilibration is not the same as DTR because DTR therapy requires all the technology because the sensor that you use is 95% accurate for the bite. If you don't
He
have
didn't
that
use a sensor.
okay, yeah, if you don't have that sensor, that's just equilibration. With equilibration, you're using articulating paper, right? The blue paper or red paper, tap, 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 grind your teeth around.
Yeah.
That blue paper, red paper, the way we're taught to use it in dental school is you put it in, and the bigger the mark, that means the higher the force. Yeah, that's BS.
Really?
That's not right. We were taught wrong. So that bite paper, you doing it that way is 14% accurate. The smallest mark can be the highest force. So you got to be using this sensor
And
and the
there's no
muscle.
way for someone to know who's using articulating paper, like if it's the big mark, if they should pay attention to the big mark or the small mark, and
Well, we're
they're
taught to
just
pay
kind of
attention to the big mark. So we think we know.
okay.
But, and I think the reason that DTR therapy, that not everybody has this in their office, it's not taken off, even though it should, is because then dentists will have to admit that we've been adjusting the bite wrong our entire careers. Do you know how many egos there are in dentistry?
Yeah.
Like, how do you grasp that? Don't even get me
Yeah.
started with orthodontists. So I'm probably gonna piss people off when they watch this, and I just don't care anymore. But
That's all
like,
right.
yeah, it's bad news bears. Yeah,
That was one of my questions is where are we? And when I say we, I mean, I guess traditional regular clinicians in a regular office, like where are we getting things wrong as far as TMJ, TMD issues?
everything is wrong, but it's not your
Okay.
fault because you don't learn anything. I didn't
Yeah.
learn anything about TMD, and I went to a really good dental school. Really, probably one of the top ones in the nation. It's the best dental, it has the best reputation. It's such a good school. But the problem is the curriculum. And there's no curriculum because there's no research. And there's no research because TMD can be a whole body issue. It can come from
Yeah.
your pelvic floor. It can come from your shoulders. It can come from your neck. It can come from your bite. It can come from a combination of all those things. How do you prove that? Who's going to do the research? I'm not. I barely have enough hours in the day. I could barely even get in contact with you. I'm sorry.
Yeah.
You had to like chase me around to get me to fill out the paperwork. So I know that about myself. Like, I don't have time. I keep doing all these things and I'm excited to do them all, but I can't do the research on top of it.
Right.
Someone's got to do the research. Someone's got to make a curriculum. It's no good.
So if we're getting everything wrong, how can we fix that? Where can
Yeah.
we learn?
Good thing is there's rabbit holes that you can go down. You can go down the DTR rabbit hole as a dentist and get educated. You can go down the myofunctional therapy rabbit hole as a hygienist and get
Mhm.
educated. You can attend courses. You can go on webinars. And so there are different ways. And of course, I have my philosophy and my beliefs. Having said that, I don't think I'm the only one that can treat TMD successfully. Different strokes work for different folks. And I think having an open mind and learning from as many people as you can, but that adds up money wise, time wise. But keep learning. That's the best thing I can say. And keep an open mind and be willing to admit, like, maybe I was doing things wrong for a lot of my
Yeah.
career, but it wasn't because you're a bad person. It's because you didn't know better, right? Like,
Well,
we
and
don't know what we know.
so much of what we're taught in school is not like valid anymore. I mean, I went
It's
to
not.
school a long time ago and we wouldn't work on pregnant patients. We just wouldn't, period. And
Yeah.
it's like now we know that's not the best thing to do, you know? It's
Yeah.
like, but I agree, we have to keep an open mind and be willing to admit or willing to just recognize that we have more to learn and that's okay.
And that's okay. But it's not okay with some people, right? And so,
Yeah.
you know, it's just hard because it's like, again, there's so many different big names that are teaching how to treat TMD, and I'm not going to name any names. I'm not
Okay.
going to do it. I'm going to keep my mouth shut for once. But all of these big names have their philosophies, and they're like, my way is the only right way. And they all hate each other. So it's like, I'm just trying to teach what I know works. And I encourage people to go to all the other courses and learn as much as they can just to help their patients as much as they can. Because that's really what it should be about at the end of the day.
So is it a matter of just like getting as many tools in our toolbox as possible? Because you're right, there's all of these classes, and it's like, what if I sign up for one and it's just the same old
I know.
SHIT that they've,
I
how do I
know.
know the difference?
I know. It's so hard. I mean, you can reach out to me privately and I can tell you what I think is the best, but I just don't want to say something and like piss off the wrong person. I don't have time for that drama in my life. Anyone can
Yeah.
DM me. I'm so easy to find and I can sort of
Okay.
guide you in what I think is the best way to move forward and what I've had the most value from because I've definitely gone to courses where I'm like, "Oh my god, it's the same old stuff." And then I've gone to courses where I'm like, "Oh my gosh, this is amazing. Like I can't wait
Yeah.
to learn from this more and more and more from this person." So, I'm happy to help, but I just don't want to do it on a public forum right now.
I get it. Yeah. Do you teach courses on this at all or have
Yeah, so I just
any
had my
programs?
first hands-on 2-day intensive course with 10 dentists. So I limited it to 12 and all 12 signed up, but one couldn't come and the other one I gave her money back, but that's for other reasons.
Okay.
It caused a lot of drama before she got here, and I was like, this isn't going to work. So the 10 that came it was amazing. So the first day
That's
was
good.
like all lecture. The second day was a little lecture and like all hands on. And some of those dentists, I would say at least 2 or 3 of them, maybe 4, suffered from pretty significant TMD. And by the time they left, because I did my hands on therapy on them, I did DTR on them, I did all the stuff I do for my patients, they felt significantly better. So it's like they get to learn and experience it for themselves. So there's my course. I would say ICMO is a great place to go. That stands for International College of Craniomandibular Orthopedics, ICCMO. They have a great conference every year, and it's not like one of the most expensive ones, but you can learn
Okay.
so much from the different speakers. So I feel like those are good places to start. Jameson Spencer's Study Club is really good if you're trying to get more into sleep, because sleep and
Okay.
TMD go like this. And I feel like his sleep stuff is just on point. So yeah, there's certain ones that I would say is a good starting point where it's not going to feel like you're drinking out of like a hose that's just on full spray, right?
Yeah.
Because
Yeah.
there's a lot to learn and it can be overwhelming.
Okay. Just a couple more questions for you because I know that you're very busy, but you mentioned myofunctional therapy earlier. And I actually did an episode on that a while ago, and I have an appointment now because
Cool.
apparently I have a mid tongue tie. I didn't realize.
I definitely have a
But
tongue tie
how
too.
does that
Yeah.
play into TMD or tongue
So
posture, I guess?
yeah, so like tongue posture, if you have a tongue tie, which most of us are born with, if you have a tongue tie, you're born with
Okay.
it. It doesn't just come on, right? So you're born with a tongue tie. What happens is that can affect your development. Some kids can totally adapt and they're fine. They can nurse with the tongue tie. Their tongue is in the right position. Great, good for them. But for those of us that can't adapt, if the tongue is not in the right position because of that tongue tie from a young age, so right position being the tip, the middle, and the back of the tongue is up against the roof of the mouth with the light suction. If it's not in that position from a young age, infancy onwards, it can affect the whole development of your face. It'll make it so your palate, these bones here, the maxillary bones, which make up part of your palate, don't grow wide, flat, and forward. And if that doesn't grow wide, flat, and forward, this doesn't grow wide. Your jawbone doesn't follow. And so everything's stuck back here, making your airway smaller. If the palate grows narrow, arched, and tall instead of wide, flat, and forward, it puts pressure on your nasal septum, causing it to deviate. So all of these things are making it so your development is way less than ideal. So not only does it affect you functionally with that very, very small airway, but many people will argue that it affects you aesthetically. Now, it depends on what aesthetics you like. I'm not going to get too much
Yeah.
into that. But functionally, it can affect you a lot. And so, myofunctional therapy is a type of physical therapy, as you know, that helps strengthen the muscles that surround and support the tongue to help you meet like 4 main goals. I think it's correct tongue posture, day in and day out, a good lip seal, night and day, correct swallow pattern. What am I missing?
I don't know.
Yeah,
I'll
there's a
learn in a
fourth
couple
goal.
weeks.
Oh, nasal breathing.
Oh, okay.
Nasal breathing all the time instead of breathing through your mouth. So now the tricky thing with myofunctional therapy is if you already have pretty moderate to severe TMD or daily pain, you cannot do TMD treatment with me and myofunctional therapy at the same time, because TMD treatment is all about putting the muscles in their happy place, and myofunctional therapy is about working them out.
Gotcha.
And they are diametrically opposed. I tried to do it all, and I made someone's pain way worse by having
Oh,
them do
okay.
exercises. I made 2 people's pain way worse because I was like, maybe it's just a one-off. And then I felt horrible and I was like, I'm so sorry. So I learned my lesson the hard way, that they can't be done at the same time. It's got to be treat that moderate or severe TMD, then myofunctional therapy. So you can do
Okay.
it. It's just later.
Okay. Gotcha. There's like a sequence that we have to
Yeah.
do.
And in your case, you're
Um,
not having significant pain. So you're good.
no, it's noisy, but it's not
Sure.
painful.
Sure. Sure.
Yeah. So, and then posture, that's something, I mean, I'm in ergonomics. I talk about posture all the time. So, I would assume forward head posture impacts the TMJ, correct?
Definitely. So forward head posture. So correct head posture is when your ear is in line with your shoulder, is in line with your hip. And none of us have perfect posture, especially when
Yeah.
we're dentists, hygienists, sitting in front of a computer like a desk job. And especially in this day and age, when we're looking down at our phones all the time or whatever tablets. But forward head posture, so every inch that your head is forward from that ideal puts an additional 10 pounds of pressure on your neck. Your head already weighs 10 pounds. How much can your neck take? Right? And
Yeah.
many teenagers are walking around 2 inches forward from
I know,
ideal.
isn't it so sad? They're so young.
They're so young. And back in the day in like the 1800s, early 1900s, they used to really push good posture. We just
Yeah,
don't
like
do
in
that anymore.
school.
In school, at home, everything.
Yeah,
Sit up straight, sit up straight, sit up straight. And so we just don't do that anymore. And so
yeah,
that can definitely, every inch the head is forward, that additional 10 pounds of pressure on your neck is so much pressure. The muscles can't handle it. And the neck and the jaw are right next to each other. So the neck being too far forward, the neck being the cervical spine, the C1, C2 being out of alignment, it'll all that alone can make your jaw lock closed.
hmm, it's crazy. So is that something you talk to your patients about too, is posture?
I do, but it's like, sometimes they're just so overwhelmed and in so much
Yeah.
pain that later on in treatment, if the posture is really preventing us from moving forward, then I talk to them about, talking to a specific type of physical therapist to help with that.
Yeah, I think that's awesome. I do a lot of like video, like how to videos on posture and take photos of myself. And every time I purposefully get into this forward head posture, my mouth pops open. I don't even realize that it's open until I look at the photos. And I'm like, how many dental clinicians are hunching over patients, mouth breathing the entire
Yeah.
time, which isn't helping with their stress? Maybe they have more pain. It's crazy how it's all connected when you start thinking about it.
It's all connected.
Yeah. Well, thank you so much for your time today. You
Thanks for
shared a
having me.
lot, and I will, if you send me the videos to link in the show notes, I will put
Yeah.
those down there.
I forgot which videos I said already, but if you
It's
text
okay. I'll email you. I remember.
okay, yeah.
Yeah,
So
but
just text me, email me, whatever. Yeah.
okay. Yeah, I'll do that.
Okay.
And if people want to get in touch with you or learn more from you, what's the best place for that?
So yeah, Instagram, YouTube, just look up the TMJ doc. Instagram and TikTok, it's at the underscore TMJ underscore doc. YouTube, type in the TMJ doc, I'll pop right up. But there's a ton of info on socials. If you're a dentist and you're looking to learn, my next course is April 10th and 11th. So it's a Friday and Saturday. I'm trying to figure out a way for hygienists to come to that course too, because everything is relevant except for the making of the orthotic, because I think
Yeah.
that's outside of your scope. But the hands-on stuff, I feel like a lot of dentists would love to hand that off to their hygienists. So if you're at
Oh, I
all
bet.
interested, yeah, let me know. But yeah, those courses, you can sign up for those on my website. I think that's tmjdentaldoc.com. So yeah, that's the best way to find me.
Awesome. Well, I'm so glad you're doing those hands-on courses. That's
They're
great. I
awesome.
wish you the best.
Thank you.
I'm trying to figure out a way how I can do something in person hands-on, but there's a
Mhm.
lot to it, so I don't know. Oh, I was just gonna say, I'll put all of your contact information, your website, and all your handles down in the show notes for people.
Yeah, and if you're interested in my April course, let me know, because there's
Okay.
got to be a way for hygienists to do it. I could bring the cost down because not all of it's going to be relevant to you.
Okay.
So, well, it'd be cool if you could come with your dentist and then I could give you like a package deal. Yeah, let's talk.
Yeah. Okay. All right. Well, thank you so much,
Yeah.
Dr. Priya, and thank you everyone for listening. We will see you next time. Thank you for tuning into this episode of Straight Up with Steph and being interested in living better. What many listeners do is subscribe to the podcast because that allows them to automatically get the latest episodes of the show. Remember, you are the best person to take care of you, and by learning what we talk about on this show, you're taking one more step to being a healthier and happier you. I'll talk to you soon.